Hello, hola, and namaste. I'm Darshana, and I'm going to be your host in this virtual space, Pelvic Gyan, the one thing. I'm a women's health physiotherapist, and I'm hoping to have conversations with a variety of medical and non-medical providers about anything and everything related to pelvic health, from pee, poo, pregnancy, postpartum, sex, pain, and more. This is a passion project to increase awareness and to get the dialogue started, but this is not medical diagnosis or medical treatment. If you have specific health conditions, please reach out to your providers and do not take your medical advice from the internet. Thank you for spending time with me. If you have any questions, comments, feedback, I would love to hear from you. Let's get started. Hello, everybody. This is your host, Darshana, and today we're going to talk to Dr. Taylor Reyes from Texas. Hi, Taylor.
Hi.
So Dr. Reyes here is a founder of a physical therapy practice in Texas called FIRE Physical Therapy, which first of all is an amazing name, but FIRE stands for Functional, Intentional, Restorative, and Empowering. All important words when it comes to physical therapy. And in her practice, she treats your everyday athletes to empowering and preparing women for childbirth and labor. She has this interesting background in functional manual therapy, and today I want to talk to her about a very fascinating connection between the jaw and the pelvic floor. So without further ado, let's get started. I wanted to start with a little bit about you as to where you're located, what kind of patients you treat, and then we kind of get into the jaw, if that's okay.
Yeah, so I'm in Farmers Branch, Texas, which is basically Dallas. You go 2 streets over, you're in Dallas, you're 2 streets over, you're in another town. Yeah. So, and I actually work out of my house, like every mom's dream, right? Mom's special. So that being said, I see a little bit of everything. With my functional manual therapy certification, it's a very holistic approach, like most physical therapy should be, but it's a very holistic approach to looking at the body as an integrated structure. So a lot of my business is just word of mouth. So although my passion population is prenatal postpartum, so dealing with like expecting moms or moms that are trying to get pregnant, or moms who are postpartum, which is basically once you're a mom, you're always postpartum. That's my passion group. But honestly, I see CrossFitters, I see distance runners, I see, people that really have no interest in physical activity, which is totally fine. And they just have pain in their back from sitting, at the desk in their job. So, yeah.
Exciting. So since prenatal postpartum seems to be your area of passion, what are some of the common things that you treat or that you see as a common concern for our pregnant folks?
Yeah. So in regards to pregnancy, a lot of people come in with general pelvic pain. During pregnancy, the pelvis starts to shift due to all the beautiful hormones that happen and just the beautiful mechanism of childbirth. So they get low back pain, pelvic pain, depending on maybe pre-existing orthopedic issues. Sometimes those can flare up, sometimes they get better. And then a lot of time I do something called labor conditioning, which is kind of a 3-step program I put together to basically help get the mom a program so that they can endure the natural demands of natural delivery, right? So they have full range of motion in their hips, knees, ankles, pelvis. They have the strength and the endurance to maintain the laboring positions that sometimes can last for hours, and that their pelvic inlet and outlet are also, optimized to its fullest potential. And then, of course, good old perennial myofascial release, which is the greatest.
Yes, so exciting. I think not a lot of people realize that they need to prepare for birth because a lot of times childbirth is considered a natural progression and it'll happen. People don't necessarily think of it as something that they need to prepare for.
Exactly. Well, and so if we kind of go back to the beginning of time, we were in environments where we had to do manual labor every day. We weren't sitting. We were squatting, bending, lifting, twisting. I mean, we were doing all the motions all day, every day to survive. So just our bodies are designed for this, but it was also designed for a certain activity level, which I think people forget.
Yes, and I feel like in some ways, we feel like the normal activities that we do, that we track on our step tracker, people consider that as a reflection of like 10,000 steps. Yes, but 10,000 steps is supposed to be a normal activity. What do you do after that is what matters. But can you elaborate a little bit more about why is it important for me to have, like, hip and ankle mobility if my plan is to go to the hospital and get an epidural? I'm not trying to go for unmedicated birth here, because a lot of times I run into this belief of I need to prepare for different coping skills or prepare for birth if I have an aspiration to go unmedicated. So can you talk a little bit about why that's important to have, irrespective of which route you choose to birth the baby?
Sure. And I think that's a great time to reiterate, whether you choose to have, whether you're choosing a vaginal birth or a cesarean section, what matters is the baby comes out safely at the end of the day. So there's, no shame in being medicated during delivery, but we just know one reason we strive for a natural vaginal delivery is least risk of complications. That's the primary thing. And then just, there's different health benefits to the baby having a natural delivery, but you know what? The baby's still going to be healthy regardless. So that being said, so say the example you had was that it's a mom, she wants an epidural. She doesn't plan on being up laboring a ton. Well, one of the things we're trying to avoid, and really just because of the risk factors, is a C-section. So a lot of times once you get an epidural, you're very limited on the things that you can do. And a big part of that is being able to tolerate the position you're in, because, we want to look at heart rate, blood pressure, the more pain you're in or distress, it can elevate those things. And once we introduce an epidural, it can not make your labor stop progressing, but it doesn't progress as fast. And that's kind of once we get into the realm where Pitocin might be introduced. And once we introduce Pitocin, that's where the uterine contractions become stronger, and that can create fetal distress if you're not dilated and effaced and ready to go. So that's once we step into the territory of, okay, once baby is starting to become distressed, is a C-section on the horizon, right? So kind of backtracking to, okay, why would I need to prepare if I'm getting an epidural? Well, we want to make sure that you're able to position yourself in a position so that that your pelvis has optimal opening for the baby to come out. So the pelvic bones should be able to flex and abduct. So it needs to open about 30% for the baby to pass through the vaginal canal, which is kind of a lot, I mean, you think about, wow, a 30% change, that's a pretty significant amount. We also need the sacrum to move along with the pelvic bones to help open up the pelvic outlet. We also need the coccyx or the tailbone to be mobile. So, and so now you kind of create a situation where, someone's getting an epidural, which is fine, but they have a history of maybe a tailbone fracture, and it might have healed maybe incorrectly, or it's stiff, or, hey, I have a history of SI issues. It's been an issue. It doesn't move that well. Or, hey, I have a history of, like, maybe I had a labral tear as an athlete in my hip. Or maybe I had a meniscus tear in my knee for whatever reason, and your range might be limited. When we're getting into this position to help promote that 30% opening of the pelvis, once you're limited in one joint or a certain area, it can create a ripple effect to reduce that 30% opening.
Yeah, that's a huge point. Yeah, medicated or unmedicated, your pelvis still needs to open. So it's sort of like you're preparing for game day, and, that just makes game day easier, if anything. So birth is where I first came across this correlation of what your jaw is doing is what your pelvis does, and, the way you push or the way you keep your mouth open or closed kind of influences that. So can you elaborate on a little bit of, like, the jaw pelvis connection in general, and then specifically to, like, during birth?
Mm-hmm. So the first thing, what is kind of beautiful is if you look at the vocal cords and the pelvic diaphragm, or the musculature of the pelvis, they look very similar. Maybe it's a coincidence. I just think it's a really unique design. Now, when we come to how, I'm sorry, I just got super excited and I kind of forgot what the question was.
The question was like, what's the connection of the jaw and the pelvic floor just generally? And then how is that connection affecting what happens during birth?
On a very basic level, when, we think about spinal placement, spinal alignment, and I don't necessarily mean like your mind shouldn't go to chiropractic care when I say alignment. I'm just talking about like how our body is naturally designed. And, our spine is positioned a certain way for shock absorption and load distribution and things like that. So when you are, say, just on a daily basis, say you're sitting at your desk, a lot of times our environment creates a scenario where maybe we don't have the best posture. And by best posture, I don't mean sitting upright. I mean sitting in a way that's compensated, that puts pressure on one joint more than another. And then over time, it can create some tightening and shortening in different parts of the body. And so we think about that in just the pelvis. And then we go up the chain and we think, okay, if your low back is, maybe slumped backwards, that's going to make your upper body kind of hunch forward to compensate. And we know we want to keep the head upright, so then that's going to create the head and neck to kind of jut forward and extend. So when we just think about a basic musculoskeletal premise, that's just going to cause a lot of prolonged overuse of muscles that aren't really responsible for that motion, right? So in regards to just the basic how TMJ and pelvic floor dysfunction or pain correlate, is just, hey, sometimes our posture just puts us in a bad position and the two just happen to be irritated at once. If we think a little bit deeper and we think about the nervous system and dura tissue, so dura tissue is basically like connective tissue of the nervous system, right? So say just I'm a patient and I walk into a clinic and I have nerve pain in my hand and it's tingling and numb, and my PT takes me through these series of tests and they say, oh, you have some cervical radiculopathy, you have some nerve root involvement, and you have a little bit of neural tension. All that's meaning is the connective tissue around the nerves is restricted. There's a little bit more to it than that, but it's restricted. And so just like you would work on improving muscle function, we can just improve the mobility of that nervous tissue as well. So we take this nervous tissue and we look at where it starts and stops. If you were to dissect the nervous system completely out from the body, it would just be all these continuous loops all over the body, like in the fingers, and the only place it doesn't loop is in the tailbone, in the phylum terminalis. And so we know that that's there, and we know that the dura tissue also connects to the coccyx, through the sacrum, right? So we have actual nervous tissue connecting there, and then if we go up into the cranium or the skull, we have the bone called the sphenoid, which is the cranial bone that sits right behind the eyes, kind of like a butterfly shape. And then there's the two little hooks. So if you were to run your tongue along the midline of your mouth and go back to either corner, you'll feel these little nubs. Those are the pterygoid processes, or the pterygoid hamulus. So there's also dural tissue connected to those hooks as well. So we think about how the nervous system is a continual loop, and we think about how, hey, guess what? I fractured my tailbone falling off a horse 10 years ago. Or, hey, I was playing basketball and I got rammed into the wall because we had a really small gym and I had a concussion. Sometimes the root cause of the connection between TMJ and pelvic floor is a little bit deeper and a little, I don't want to say complicated, but just a little bit more hidden than you would normally think.
Yeah, this is so fascinating to kind of think about it in the nervous system angle of things. And a lot of times, as you said, you might not make that direct correlation because the fall might be 10 years ago, right? And it kind of sometimes takes time to build that up. So what are some of the signs or some of the symptoms that make you think, okay, do you have something wrong with your pelvis when you see a TMJ problem or vice versa? What are some of the things that patients should kind of that prompt that this connection might exist?
Yeah. So, and again, this isn't necessarily related to pregnancy or postpartum,
right.
But sometimes questions overlap.
Mm-hmm.
So if someone comes in with TMJ, and a lot of times these questions apply to men as well, really is, you know, as long as it's not related to reproductive organs itself, we could kind of be interchangeable here. But if they come in with TMJ, you know, one of the things I ask is like, okay, well, tell me about or TMJ pain. Tell me about your history. You know, have you had any falls? Have you had any accidents? Do you have low back pain? So things that someone could be looking out for is, okay, after I sit for a while, do I get pain? Or if I'm standing, do I get pain in my low back? Do I get it in my pelvis and hips? If you're a female, do you have, you know, there's a possibility that they might have pelvic floor pain, and not just like, hey, my SI joint hurts or my hip hurts or my low back hurts, but it could be more of like, hey, I have pain with vaginal penetration during intercourse, or hey, I feel like I can't empty my bladder all the time, or even if it's not just the deep penetration during intercourse or the superficial, it might be like, well, it's not painful for penetration, but it's kind of, you know, during activity, it's painful in certain positions, or even chronic constipation, because we know how the lower part of the spine ties into the digestive system. So pelvic floor pain, constipation, gut pain. So say they just have a really like rumbly tummy. Sometimes that can be involved as well. Emptying problems.
So it sounds like it's more related to like issues with like a pelvic floor that's tight or overactive or is having difficulty relaxing. Is that accurate?
That's not, most of the times that's it, because it tends, and here's another thing to add to the response. People who tend to be more type A or very, and I don't want to say very driven because, or just, I don't want to say high strung in it and it sound negative, but just
go-getters.
You feel like you can't catch a deep breath, and you're always living with your shoulders in your ears, or you're just you have to actively unwind.
Mm-hmm. And when you see that, when you make that correlation, is that at that point we're thinking about they need to work on those pelvic issues to address their TMJ problems, or do they need both, or, you know, the chicken or the egg? Like, what do we address first here?
You know, so it's sometimes. It's really not all the times, and because there's a lot of times where someone comes in, and typically I get a pelvic floor patient, and I start asking them about TMJ pain, if they have TMJ function, or so I end up seeing people more for pelvic floor pain, and then they say, oh, by the way, funny you ask, I do clench, I do grind, I do this, et cetera, et cetera. So once we go through the exercises, because a lot of times overactivity is just learning body awareness, learning how to relax, learning how to eccentrically engage your muscles, which would be the opposite of tightening them up. Once we go through that, then other things start to resolve.
So with that progression, then I'm thinking like if there is a person who has had, let's say, a lifelong history of digestive issues, not necessarily a certain diagnosis, but they've known that their stomach has had some issues all their life, and they are this type A person who is always stressed out in life, just that's where their life is. So what are some of the things that person can do to kind of be preventative of, because we know that this pelvic floor issue can result in a TMJ issue. What are some of the things to look for or do proactively so that it doesn't get there, specifically towards the jaw?
Yeah. So I'm very much a proponent of mind, body, and soul. Right. And so to be able to even address those three things, you have to have body awareness. Right. So one of the biggest things I tell my patients to do is start for a week straight, every hour, because, you know, if you give yourself a goal, a deadline, it's much easier to achieve than if you say for the rest of your life. So for the next week, every hour, set a timer if you have to, I want you to stop and take an inventory of what your body's doing. Okay. So where are your shoulders? What is your neck doing? How are you breathing? Are you breathing in your chest, or are you breathing diaphragmatically, like kind of doing belly breaths? I know there's a little bit more to it than that. What position are your legs in? Are your feet grounded to the floor? Are you furrowing your eyebrows? Are you clenching your teeth? Just do this inventory and start there. And then once you take that inventory, relax, right? Just shake it out. So whether, if you can literally just shake it all out, great. So you have a starting point, or this is where I might be a little bit more specific with an exercise and just say, okay, now let's do a cycle of diaphragmatic breathing with pelvic floor activity. So you would inhale, belly out, pelvic floor drops or relaxes, and then exhale, belly in, and the pelvic floor comes up, right? So that way we're kind of hitting both realms, and then again, be conscious of what your head and neck is doing.
Yeah. And what are some of the common things people with jaw pain would be experiencing? And that's not necessarily related to the pelvic jaw connection, but when we say jaw issues, like other than pain or locking, are there other things that qualify as TMJ issues?
Yeah, so a lot of my patients with TMJ issues have headaches, constant headaches and neck pain. They go hand in hand, and they really get that kind of deep, like, oh, I just need to like lay my head against something cold, or just that ache. So, or even their teeth might hurt. Right? We think TMJ, and we kind of, when you think the temporomandibular joint or with pain or dysfunction, a lot of people just go to, oh, it just clicks when I open and close. Well, I mean, clicking can be normal, right? Our bodies are naturally asymmetrical. So it's going to happen that you have some clicking here and there. Now, if it's painful, that's an issue. So if you have painful clicking, or say you open your mouth, I had one girl one time, she opened her mouth and it would go just like a zigzag all the way down, very extreme. And I'm like, that's not efficient. So we want to work on that. But I can tell you, with all of my TMJ patients, I very rarely actually touch the TMJ.
Interesting.
It's always upper cervical, cranium, and then the muscles that connect to TMJ. So I can't remember when the last time I did a distraction mobilization, which is very common, where the therapist puts their thumb in the patient's mouth and kind of pulls to stretch the lower jaw away from the upper part of the jaw, either up or down or side to side. And that, it's been a long time since I've done that, just because if we can get this upper cervical spine and the cranium in an efficient position, and then we just work on getting the tone out of the pterygoids and the masseters, it all falls into place.
Yeah. So where is this journey? Like, how are these people landing here in terms of, if somebody has a jaw issue, should they seek out a physical therapist, or is there a certain point where you realize, okay, this is a muscular issue and go see a PT? Because I'm guessing not a lot of people with jaw issues would first reach out to a PT.
Sure. Yeah. I mean, so, and that's a great question, because, and that could segue us into like 3 hours of discussion, but to keep it brief, if you're not comfortable seeking out a PT, I would always say seek out a PT. If you have musculoskeletal pain, seek out a PT first, because we know statistically that a patient is 89% less likely to become addicted to an opioid if they seek out a physical therapist first for orthopedic pain versus a primary care physician. So always, whether it's your TMJ or your low back.
Yeah, right. That's a big statistic number, yes.
Yeah. Now, if you're super dizzy and your blood pressure is super high and like weird things are going on, please go to your doctor, right? Mm-hmm. But finding a biological dentist could be another option, or a dentist that specializes in airway-centric therapy. And so that's looking at the bite, because a lot of adults sometimes still have tongue ties or upper lip ties, or they might have narrow airways. And a lot of women, they have symptoms like, they say, I have sleep apnea. Like, I know I have sleep apnea. They do the sleep study. They don't have sleep apnea, but they still have all the symptoms related to sleep apnea. They have low thyroid issue. They have thyroid issues. They have the bags under their eyes. They don't feel rested, et cetera, et cetera. And there's this condition called upper airway restrictive syndrome, and it's very common in women. And it's where the the back part of your mouth and of your airway is restricted just enough to create some obstruction, where it's just this low level of obstruction to your airflow 24/7 versus just when you get in the laying on your back position and your mouth opens funny and it kind of clogs the airways, so to speak. And that can be very, very important for solving chronic issues. I've had a patient who, we did a lot of TMJ and kind of, after we know within 1 to 2 visits how successful things are going to be. I mean, if you don't see a change after 1, especially 2 visits, you need to go back to the drawing board or maybe see someone else. So if a patient's going to a therapist and after that first visit, they may not be they certainly won't be 100% pain-free. If they are, awesome. But if they don't see an active plan and see how things are going to get better, they need to seek out someone else. But I had one gal who we did a lot of treatment and she would get better, but she wouldn't stay better. And then she found a biological dentist who ended up diagnosing her with a tongue tie. And once she got that taken care of, like lasered, all of her problems went away.
Excellent. Yeah. I guess you gotta find the why. Like, why are you having this? Like, you address the root cause and then it stops coming back, it seems like. Yeah.
Yeah. And I think this is for listeners, this is an important thing to reiterate. Like, therapists work very hard. They do a lot of problem solving, we can make a lot of gains, but we're not always the right person. And especially with pelvic pain and temporomandibular joint pain, it can be very chronic and it can be a long road. So you are allowed, as a patient, you are allowed to maintain an open stream of communication with your therapist to make sure you're on the same page at all times, that there is a plan, that you're not just kind of checking a box every time you go in for treatment, but that it is like there is a plan for continual progress. And that if you do start to plateau, okay, maybe challenge your therapist. What's something new we can try? Like, how can we think outside the box? Because I think in healthcare in general, not just PTs, especially like physicians and things like that, a patient thinks that they're just at the mercy of whatever the provider says, and that's not true. It should be a two-way conversation. You should be able. There should be respect, obviously, for the profession, but when you're on a long journey of chronic pain, sometimes you have to speak up because, we therapists and doctors see a lot of people and a lot of the same issues. And sometimes, it's okay to have a little jostle from a patient to say, hey, what's something different we can do?
Yeah. So it sounds like chronic problems might need a longer plan, but as long as you're seeing some change, good or bad, there needs to be some change. If there's status quo, it's atypical for TMJ because it does tend to respond. So
yeah, and especially because a lot of times it can be flared by stress, right? So if you're naturally a stressful person or you stress easily, you need the goal isn't necessarily to be 100% pain free. The goal is to manage the pain to where you're comfortable and understand your triggers and say, oh, this is coming up. I need to do X, Y, and Z exercise, or I need to prepare this way. And when the pain hits me, it's okay. Like, I know where it's coming from. It's not controlling me. I'm in charge, because that's half the battle with pain is understanding where it's coming from and knowing that you're not the victim.
Yeah. And that's huge what you said, because knowing that what your triggers are, because it gives you some sense of management of, picking up times where this is going to flare you up, and that's probably not in your schedule that day. That's not an advisable activity, so you can avoid that. But sometimes I feel like patients get in terms of management, patients get very confused as to, is this something, especially for people, like you said, some people have a tendency of getting stressed easily, or just their life is very stressful in many angles. Are we talking about somebody getting to a point of managing this on their own, or are we talking about some level of intervention and at a longer time if this is not an acute thing and we're dealing with chronic pain? What are we looking at from?
Sure. Yeah. So and this is kind of an estimate, just what I might typically see is if I'm working with a patient, we're day one and they have a chronic condition and it's going to take a while. what I typically end up doing is seeing them for 6 weeks, once a week for about 6 weeks, 4 to 6 weeks consistently. And then and the idea is to get to a place where they're equipped with do-it-yourself exercises, like do-it-yourself mobilizations, because I am very heavy in manual therapy, so that they can be their own therapist, so that they can walk away and say like, okay, we get them out of the acute pain where it's like, oh my gosh, I need help, to where they say, all right, I understand where this is coming from, and I can implement these strategies, and then I come back to Taylor maybe once a month until I feel like, you know what, I'm good. And then, I might get a call like 6 months later. Well, I don't know what's going on. I need to see you. I just can't get the pain down. And then I see them. Well, what's going on? Well, not a whole lot, but, my sister's getting married and I got a new job and we got a new dog. And you start listening. It's like, okay, well, those are
That's
all,
a lot.
Good stress, but it's still a lot. So, sometimes it can even kind of get the best of us and we forget what our triggers are and things like that. But certainly it should never be a revolving door. I mean, unless you have a very unique, specific situation, I very rarely see people twice a week because it's just not typically not necessary. It's unless they're just, bent, like crawling into my office and that's what keeps them upright. But it shouldn't be this revolving door of care. A patient shouldn't be dependent on a provider's schedule. So the idea is to get them as independent, as autonomous as possible. And the whole concept of you need to come in 3 times a week for 4 weeks, and then 2 times a week for 3 weeks, and then 1 time a week for 4 weeks. Like, that's not like, why? Why?
Yeah. And thank you for sharing that, because that's very empowering. A lot of times one of the barriers people have is, oh, that's one more appointment that I'm gonna have to do for the rest of my life, and that kind of becomes a barrier of starting something. So in this way, it's good that they know that there's something that they can learn and do themselves, right? So I'm thinking about like somebody who knows that they have some tendencies that put them at risk for tightness or overactivity around their TMJ joint, or they have an existing issue that they've known as a young child or an adult, and now this person is pregnant and thinking about all this, how this is going to affect my pelvic floor and what that means in birth. What are some of the like advice or kind of clinical pearls for this person to kind of preventatively do or work on or keep in mind when it comes to handling pre-existing issues and not letting that get in the way of their pelvic health during birth or postpartum?
Sure. Well, in the sense of treating or managing or looking at the TMJ to prevent pelvic floor issues, I would say it goes back to the state of stress. What are we doing there? As far as like, hey, I'm already overwhelmed with a growing belly and changes in my body, the last thing I need is my TMJ to start hurting. One of my favorite little go-to exercises is just, it's a little mobilization that you do. And I have, I'm not sure if when the last I washed my hands, maybe a couple hours ago, but I'm not going to stick my hands in my mouth, is what I'm saying. Basically just and I like to do it with gloves on just because I like the traction. You would take your hand and you would stick it inside your mouth, basically going up towards the ear, so into that back corner. And then you're going to feel, especially if you have TMJ issues, you're going to feel a good amount of sensitivity. And you're just going to hold that pressure there, and you're going to maybe open and close your jaw. You can move it side to side. You can just nod your head up and down because we want to keep it functional, right? So what are movements that you actually do throughout the day where you might experience pain? And you just hold it there. And I like to set a timer for just 2 minutes or something like that. Keep it pretty basic. And go from there, see how your body tolerates it. And that's a great way to get kind of that acute like sense of like, oh, what's going on? Another thing is a lot of people do not like mouth guards. A lot of dentists recommend mouth guards. I think it's kind of like orthotics, right? I don't love orthotics for feet because we need to address mechanically what's going on before we throw a wedge in there, essentially. But if you're not able to get into a PT or whatever, you kind of have to be independent at this time. What I would say, instead of getting a mouth guard, especially if you clench and grind, is having your dentist make you retainers, like the Invisalign retainers. So that way they're much more, and they're not making them to change the shape of your teeth, just to maintain the shape, but that way it protects your teeth overnight if you clench and grind, or during the day. Like, say you grind at work, pop those babies in while you're at work, so you protect your teeth and your bite. And that comes from personal experience. I have, because we're all candid here, I have pelvic floor issues and I have upper neck, and I don't have TMJ pain, but I have stuff going on from previous accidents. And it was getting to the point where every time I'd wake up in the morning, my teeth were loose because I would just jut my jaw back and forth so much throughout the night. And, especially when you have a baby, sleep is basically just perpetual naps for the first 6 months. Right. So, and I was like, napping, it was worse for me. So I was like, I can't do this. Like, I need help. So I told my dentist, I was like, get me some retainers. And sure enough, so I can say this from experience now too, my teeth aren't loose anymore, and I don't have nightmares about my teeth falling out. And so that alone, when you think about it as a mom with all the other things you have to be anxious about, I don't have to worry about my teeth falling out. And it's much more comfortable than a mouth guard.
Yes. And so it sounds like there are some identifiable stressors when it comes to people flaring up TMJ, like, just emotional stress or life stress. And then we talked about like trauma, like somebody having any injuries or accidents that affected their neck, or concussions, like sports injuries. Are there any like subtle or other triggers that we wouldn't even think that would affect somebody's TMJ, but we kind of need to know of?
Yeah. So how are you using your phone every day? We've heard of text neck, right? Where they're getting, like, a lot of young kids are getting disc issues in the lower part of their neck because of the way they hold their head and neck. But are you here, thus creating upper cervical issues, or the joint, the vertebra in the upper part of your neck. And again, like, when we kind of go back to how I treat TMJ, it always starts cranium and upper cervical. If you look in an atlas, everything is just so compact. So if you're one of those people that just hang your head and text, and you probably everybody does, it's like you have to it's like you need to set up a hidden camera to see how much you actually do it. So what I would recommend, instead of, yes, use your phone, sure, it's like integrated into our function now, but instead of hanging your head, think about your inner ear being a point of access for like a point of motion, and pretend you have a rod through your inner ear on both sides, and you're pivoting down through that, or you're maybe tipping your nose down and you're texting here versus hanging your head, because it's really not realistic to have your arms up like this. People say, hold the phone up in front of your face. No, nobody does that. Like, that's hard, and your arms are tired. So, it's just instead of dropping your head, just a simple tilt with your nose.
Yeah, that's huge. I don't think a lot of people recognize how they text has a lot to do with how they're, affecting their joints. So thank you for that tip. I wanted to, and that was all of my questions. So I wanted to end with, like, if there is like any resources in terms of books or videos or any special, I don't know, some kind of resource that sometimes people have TMJ issues, they have other issues, they know they need to see somebody for it, but just life doesn't allow that at this given time to seek out professional care. So I know you talked about doing something for pregnant folks in preparation in terms of TMJ MOB, but are there any other resources that people should know of?
Yeah, so aside from doing the self-mobilization to the muscles, so you like as far as exercises go? Sure.
Any, like, even if I want to read about, like, what I'm having, is that normal, or is that something I should see somebody about? Like, just kind of general resources.
Right. Well, you know what? It's especially in regards to TMJ and pelvic floor, there's not a lot of great research. There's not a lot of great literature. It's just not out there yet. And I think it's just because a lot of this is becoming, it's kind of not a woman's issue. And but kind of, it's like that's what it's being expressed at this time. And women's issues are just now starting to be addressed. I mean, what we just now, in like, how many years did we just have the next non-hormonal form of birth control on the market? Like, how long does it take? Like, why are tampons still tampons? Like, well, like, why is there not more? So, okay, I'm going off on a tangent, but anyway, so there's really not a lot of stuff out there, and I'm not a researcher. I'm not going to do it. So I would say if there is anyone listening that's a researcher, this is a great research project. But as far as resources, just knowing how stress related this stuff can be, there's two things. Exercise. If you're not exercising regularly, if you're not strength training regularly, you need to be strength training regularly, especially with chronic conditions. It is like, and you don't have to go have a PT for this. You don't have to have a personal trainer. You don't have to go to a fancy gym. Like, just getting some regular form to challenge your muscles aside. I'm not even talking about the head and neck. I'm talking about your shoulders and your back and your abdominal core and things like that, so that your body can, it's not just your head and neck hanging out here, and your body can adapt to it. But two, knowing how stress related it is, like, find something to soothe your soul. We don't take that into consideration enough. And I think it's very clear how much mental health has been, it's finally starting to break through, and people are starting to acknowledge that stress, anxiety, depression can be a detrimental thing, and it's starting to be acknowledged. But we also have to be accountable and say, I need to slow down for a minute. And it's interesting during this, quarantine season, this unfortunate quarantine season, one of the silver linings is people are realizing how once they slow down, it can change things for the positive for them. So whether it be whatever beliefs you have, tapping into that, or taking up some sort of meditative practice, it doesn't have to be, it can be anything. It can just be you taking a moment to sit and be still and just appreciate the environment you're in, or just take one thing to focus on, right? To just slow your mind and just bring it down. Because remember, we talked about the nervous system. And so we know if we can calm the nervous system, that feeds into the rest of our body.
Yeah. Thank you. Thank you so much, Taylor. This was very helpful. The next part is a series of quick questions. I call them the one thing. And they are basically meant for like quick answers to just very popular questions that people have. And all along realizing that the answers are always more comprehensive, and there is more that goes into it. And what is a right answer for me may not be a right answer for somebody else. So it all depends. However, these questions were more to kind of highlight some of the things that are really important or priority when it comes to that particular question. So I'm just going to ask you a bunch of questions with the expectation of like quick, short answers. And of course you can give 2 answers if you want to, but we're looking for like, quick and short response. So what's the one thing that's the most common symptom of TM joint problems?
Pain. I mean, you mean, when someone's coming to me for the TMJ symptoms, it's typically because when they are trying to eat, or they can't open their mouth wide enough to get food in, or it hurts too much to actually bite down on the food.
Yeah. What's the one thing that you see as a common kind of like predisposing factor or precursor to somebody developing jaw issues?
Neck weakness.
Yeah. What's the one thing that you see is wrong with the pelvic floor when somebody has like chronic TM problems?
Poor neuromuscular control.
Yeah. So it all goes back to sort of like neuromuscular system here. Mm-hmm. And what's the one thing that you see as a common kind of personality trait with all the people having jaw issues? And I think you kind of tapped on it, of people who tend to have a very stressful life or stressed out personality. But is there anything that we missed out there in terms of common personality trait when it comes to having TM joint problems?
Anxiety. I mean, just any type of personality that would keep people from being in a more state of relaxation throughout the day. And I don't even mean like, oh, let's kick back and have a beer type of relaxation. I mean, just, the even breathing, just calm, centered, right? So, and you may just have like a lot of irons in the fire, right? You may not feel, your personality traits may not be high wired. You know, you might not be like, people might not perceive you as an anxious person, but if you have, okay, I got to get the kid to this place, or I got to have this meeting at that time, I also got to get my work in, I got to do this, I got to do that, I got to do that. I mean, it's not a bad thing, but I think that like just looking at your daily activities and seeing like just the number of activities could be a red flag or a risk factor for developing something, which isn't a bad thing. You just need to be able to identify it.
Yeah, sometimes I think that's your normal, so you don't recognize it as overwhelming or stressful because that's your Tuesday morning. But when you take an objective look, that could actually be too much. What's the one thing that you would tell people to expect when they're seeing a physical therapist for TM joint problems?
Good education.
Okay. And what's the one thing to look for if they're looking for a dentist specifically for TM joint problems?
A biological dentist.
Okay. And what's the one thing you want people to kind of know like a good health habit, or avoid this if you don't want to develop TM joint problems kind of thing?
Oh, I want to say exercise, and I also want to say mental health, but maybe meditate while you're exercising. You know, because I mean, it goes hand in hand. Also, you know, don't, you know, if you're eating a real big hamburger, don't get too excited and take too big of a bite, because I can't tell you how many times I've seen people, well, it started 2 years ago when I was eating this whatever, and I just opened my mouth a little too wide.
Yeah. So, all right.
There's that basic stuff.
Yeah. That was all of my questions, but I wanted to ask you if there is anything that I missed out on, if there is any question or any concern that you frequently get asked, or you feel like everybody asks me this, like something that you feel like I should have touched on and I didn't.
No, I mean, I feel like we covered a lot of stuff, a lot of good stuff. I would say that it's never in your head. Like to anyone listening, it's your pain. It's never in your head. And a lot of times with pelvic floor pain and TMJ pain, you might get shuffled around before you actually get in front of someone who knows what's going on with you. So never stop asking why, and you just have to be your own advocate, because there always is a better option. Like there's always a better way. Right. So just because one person tells you, oh, take this muscle relaxer. No, that's no.
Yeah. And it's sad, but it's true that you have to be your own advocate, because a lot of times people go to a provider thinking they will look out for my best interest, and they do for the most part. However, you know, you always get better care if you are an active participant in that team, as against just following the instructions. So thank you very, very much. This was very informative. It has always been fascinating to me, the association of TMJ and pelvic floor. And I don't treat a lot of TM joint problems. So I have this local PT that all she does is TM joint problems. And I can't tell you how many patients we share, because I will see something and I will send her and she'll see, and it's just it's almost like become a little game where I will, in my head, already know this person is going to say yes when I ask them a question about grinding, just working with the pelvic floor that I see. So you're right. There is a huge window there for research, and somebody's going to pick up on it pretty soon. But thank you very much for your time and for all the wonderful resources you shared. I'm going to add a few notes in the show notes for the things that you said, so people have quick reminders. But thanks again. I really appreciate this. Have a wonderful rest of the weekend. But before we log off here, do you want to say something for people who want to find you, to know where on the internet they can reach out to you, if that's okay with you?
Yeah, absolutely. My website is just firephysicaltherapy.com. I'm very active on Instagram, and my handle is Your Lovely Pelvis. I do put out a lot of like self-treatment videos or exercises, and then just like little mini blog stuff. So, you can DM me on Instagram. You can shoot me an email at taylor@physicaltherapy.com. I'm also on Facebook. So, just if there's anything that you hear that resonates with you, and you just want to kind of brainstorm a little bit more, feel free to either DM me or shoot me an email.
Cool. And I will include that in the notes again with her Instagram handle. And it is a wonderful profile, so you should check it out. Thanks again, Taylor. I'm going to log off, and there might be a little delay in when this logs off. But yes, again, thank you very much, and have a wonderful rest of the day.
You too.
All right.
Bye.
Thank you for listening in. I hope you enjoyed this episode, and I really hope you got something out of it. I appreciate your time, and I enjoy hearing back from you guys. So if there are any questions, comments, or concerns, you know where to find me. If there's a topic that you've been wanting to hear about, reach out to me and I'll see what I can do. Once again, thank you for being here. Stay safe, and don't forget to come back. Peace out.